Hello, my name is Joshua Kanamiya. This is a presentation on our research project from epidemiology of chronic diseases. We were interested in assessing the relationship between alcoholic liver disease and education levels in Florida adults. So if you're not aware, alcoholic liver disease is a leading cause of alcohol-related deaths every year. There's also a student dropout crisis that has been occurring in the US. Without a diploma and depending on socioeconomic areas, it's unfortunate that some adolescents may follow low-income jobs and be burdened with those more stressed and become reliant on alcohol. These studies showed that high school dropouts tend to have a higher relative risk to becoming dependent or abusing alcohol than those with a college-level degree. We wanted to explore the relationship between high school graduation rates and deaths from alcoholic liver disease in Florida adults in an ecologic study and compare these results with a high-quality analytical study design. This inquiry has led to the hypothesis that there is a negative correlation between alcoholic liver disease deaths and high school graduation rates in Florida adults. We were interested in looking at the data available from both an ecological analysis and looking back through literature reviews of the analytical study designs to see how the data may be useful for crafting health, education, and public policy recommendations in the future. So we did a correlational analysis, high school graduation rates and alcoholic liver disease deaths in Florida using data from the Florida Health Charts, which is a publicly available secondary data set. We downloaded the prevalence and age-adjusted graduation rates and mortality rates, and then we calculated the correlation coefficients and p-values. Using Microsoft Excel, we had a statistical significance that was defined as less than 0.05, and those results were displayed here in figures 1 and 2. We also conducted a literature search. We had keywords that included liver disease in Florida, alcoholic-related liver disease in Florida, liver disease in America, alcoholic death in Florida, liver disease in education, liver disease in income, and cohort studies and RCTs to try to find those analytical study designs only. We also limited our results to articles that were published in the last 12 years. In countries that were similar to the United States in terms of their economy and healthcare system. Of course, we only wanted to look at epidemiological data in human subjects. So for the results section in figure 1, we had a county level analysis that looked at the relationship between high school graduation rates and deaths due to alcoholic liver disease for all 67 counties in Florida. The 2020 Florida County high school graduation data from the Florida Health Charts proved to be inconclusive in determining whether there was a correlation between high school graduation rates and alcoholic liver disease deaths with an R value of 0.071. This indicates a very weak positive correlation at a statistically insignificant level, as our p-value was 0.556. However, when the data from Florida's statewide high school graduation rates across the years 2001 to 2020 were compared with alcoholic liver disease deaths, the results showed a strong correlation and statistically significant positive relationship, with our R value being 0.862 and our p-value being 0.000 between high school graduation rates and deaths from alcoholic liver disease. These results indicate that those who graduated from high school were at a higher risk of death from alcoholic liver disease across a greater time span. For our literature review, we found 4 analytical study designs, 3 of them being cohorts and 1 of them being an RCT. All had large sample sizes used in the study and were examining a similar research question. All 3 of these results also had statistically significant results, but all of them contradicted our findings. The results from the Florida Health Charts 2020 Florida County high school graduation rates data could not support most of the data gathered from the studies included in the literature reviews. The Zeglin study demonstrated that the greater levels of education significantly decreased deaths of despair, including liver disease. However, Our analysis data could not confirm this effect. In fact, our data indicated that the greater education would lead to a greater likelihood of experiencing alcoholic liver disease death when analyzed across a 20-year time span. Similarly, the Katana study also found a significant inverse relationship between economic prosperity and liver disease-related mortality, though no significant relationships were found in our analysis. The Molina study showed that increased alcoholic taxes to an effort to reduce access to alcohol led to a reduction in alcoholic mortality rate, which again was not directly supported by our data. Fairbairn's study, however, reported that regardless of education level, alcoholic consumption rates continue to climb, which is similar to our findings that there was not a significant relationship between high school graduation rates in Florida and alcoholic liver disease deaths. The results from the 2020 Florida County high school graduation rates analysis were inconclusive, though the statewide data throughout the years 2001 through 2020 demonstrated a strong and statistically significant R value being 0.862 and p-value being 0.000, which is a positive relationship between high school graduation rates and deaths from alcoholic liver disease. This differed from our initial hypothesis that a negative correlation would exist between high school graduation rates and alcoholic liver disease deaths in Florida adults. Reasons for this may be that those who graduate college may have greater levels of disposable income to spend on alcohol and are more likely to live somewhere that has more bars and alcohol serving establishments, or may develop binge drinking habits in college. More research is warranted and could look at different indicators of education, such as obtaining a college degree, to support or challenge the findings of this study. Our references are listed here as well. And if you're interested in where we pulled some of our data, and we would love to answer any questions. If you think of anything, let us know. Thank you so much for your time.